Atira Women's Resource Society is a women's anti-violence organization. We are a low-barrier organization, so we tend to work mostly with women who have experienced violence and who are also struggling with substance use, struggling with mental and spiritual wellness, who are homeless or at risk of being homeless. SisterSpace was a dream we've had for probably about 10, 12 years. Shared using rooms or overdose prevention sites provide a safe place for women to use together, to look after each other, to care for each other, to reverse overdoses, obviously.
We're not here to fix anyone, we're just here to meet the women where they're at and make them feel safe.
Well, we're keeping them alive, and that's the bottom line.
I just think it's a fantastic program. I think there should be more across the country and the world. I think anywhere a woman can feel safe to do anything or feel safe is a good thing. There's not enough places for women.
There is a significant lack of women-only services available in this community. Co-ed spaces aren't safe. Having more women-only spaces of every service or variety, I think, is critically important to women, first of all, accessing services, and second of all, continuing to access those services. It is violence and trauma informed because it recognizes in our daily practice the relationship between women's experience of violence and their use of substances. And it validates substance use as a coping mechanism as opposed to judging.
We're open from 6 a.m. till noon, and then we open again at 6 p.m. till midnight. We are trying to get our hours lengthened so the working girls at nighttime have somewhere to go, because there's nowhere else like for only women.
It's a space where women can, feel safe and comfortable, valued, believed for at least part of their day.
Some of these women are coming from violent relationships, or lost their kids because of their drug habit, so they need so much more support in that area. And then a lot of them are homeless, so they need outreach workers to get them housing. So you need a whole circle of things to help a woman, I think.
For many women in this community, many women who've experienced violence, one of the things that's almost certain is that your life is chaotic. And so what we try and create in our spaces is it is consistent predictability. I think it helps all of us feel safe knowing that we don't have to walk in eggshells and wonder what's coming next. Like everyone else in the world, people react to rules. No one likes to be told what to do. So we set up guidelines that set up guidelines that are actually developed by women who use the space and are meant to exactly as that, as guidelines for how we interact with each other in this space. But it doesn't say you can't and you must not and you won't. The best way that we can be accessible to women and children impacted by violence is to reflect those women in our staff, the women with lived experience. The peer staffing model here are women who either are currently or have in the past been IV drug users. They know better than almost anyone else how to use safely, so that knowledge gets passed on. So women who use this space have reported to us that it's the peer staff who bring them into this space and help them to continue to feel safe and want to come back.
I'm Jenny. I'm the peer supervisor here at SisterSpace. So what drawn me into social services is I have a lived experience with partner violence, substance use, and mental health. And I managed to get out of it, and now I'm in recovery.
My name is Tana, and I work at SisterSpace. I can see myself in the girls, and it makes me feel good to be able to do something that I would like to have had done for me when I was down here, right?
I was a IV drug user for the last 30 years. The last 10 years I've been in a prescription heroin program, so I have been stable somewhat. Okay, I like being a peer support worker because of the girls. They need support.
We know where they're coming from. And it's not like somebody saying, oh yeah, well I went to school and read a book about it, right? We've walked in their shoes and know what they're going through.
So it's just like there's no separation in between them and us, so it's like just a big community.
It removes barriers to support and services and building relationships. It creates or helps enable a sort of common shared experience that relationships can be built on.
We get about like 60-75 women in a day. We got a lot of great feedback from the women accessing the space. They like the community in here.
You can see that the space is, or we've tried to make it as much like a living room or a kitchen space as humanly possible. So women develop relationships with each other, they share information with each other, not only about bad drugs, but also about bad dates or violent men or things that cause risk to women in the community.
We have to focus more on the quality of their state and the connection they're building while they're here.
Well, you don't want to feel like you're alone, right? When you're like, already you're by yourself, but you know, you need to know that somebody cares about you to keep on going.
A lot of the girls have saved lives. We also have Narcan kits here that we train the girls to use them and take them out with them. So if they are using with a bunch of friends, or if they happen to be, you know, away from an injection site, they have the Narcan to save a life. To bring somebody back is emotionally draining. So they come in and talk about that, or when they've lost somebody. Women do the arts, and that's all the artwork from the girls that come in here, which is great.
To express yourself in a different way than doing drugs, right? And it's really helpful. You can just see the different people and what they've done, and it's got to now be poetry and stuff that's being put up there and stuff. It's wonderful.
So anything that you can engage them in, other than concentrating on the dope, is good. Good for the mind, good for the soul.
Referrals are made to housing. Obviously housing saves women's lives as well, safe, affordable housing. Access or referrals are made to other kinds of services like counseling, self-help groups, pretty much anything women ask for. So it becomes not just an overdose prevention site or a safe using space, but a place where women can access information, and information is power, and information saves lives.
Well, it's important to have all kinds of information in other communities so they can, if they're not comfortable here, they have other places they can go if they need anything and they don't want to ask. A lot of them don't trust asking anybody anything, so that's why we put everything up so they can see it for themselves and get the information on their own.
Besides coming here, I don't go out a lot because I'm like them, right? I'm the same. I stay to myself and stuff, and the only time I really get out to talk and stuff is when I come here. So this has helped me as much as it's helping them, and it's great. I'm really grateful.
We know what we need and we know what's best for us, so letting us talk and tell for ourselves what we want.
Well, like I said, I'm getting to be able to know that it's okay to be who you are and to be a woman and to be addicted. It's all right. We're okay.
I think the women feel value here, no matter the stigma they can be facing outside. Here they're seen as a human with tremendous experience and strength and resiliency, instead of like focusing so much on like the substance use and like their hardship. We try to focus on their strength and their courage and build on that.
I wish SisterSpace had been around longer. I wish the need had been recognized and funded sooner. I've lost some friends over the last number of years that I believe may have been saved if SisterSpace had been around, a place not only where they could have used together, but where they likely would have contributed as peer staff. So yeah, I just really regret that this need wasn't recognized sooner. I believe so.